So, hi everyone. Sorry for a little bit of delay there. We had some interface problems with getting the Zoom live going, but we want to welcome you all. We're so glad you're joining us and Happy New Year. We're starting off the new year with what we thought would be a great topic, which is what does a happy horse look like? And before we get rolling, forgot to do my introductions. I am Megan Phillips, and I am a co-founder of the Train with Trust Project, here with Jody Ambrose, the other co-founder of the Train with Trust Project. We're a nonprofit dedicated to making animal behavior information accessible for everyone and providing help with evidence-based animal training and care methods. And of course, Dr. Sue Dyson is with us today. We're so grateful for her time once again. Um, world famous, world famous equine orthopedist, fresh back from the holidays and vacations. So we are going to start today with talking about what does a happy horse look like? So Jody, I'm going to go ahead and turn things over to you. I will be in the background to field any questions and help run some things if we want to look at some photos and stuff. And Jody will take over and talk about what we're going to be discussing today.
Okay, hi everybody, and welcome. And we wanted to start off the year, as Megan said, with something, coming from a positive angle. We've done our last couple of lives have been on some pretty serious topics, and we wanted to cover something that is important, but also coming at it from a positive angle. As everyone knows, discussion on social media can get pretty contentious, and I think we've started off this year with a couple of topics that a couple of conversations on social media that have been particularly volatile, and we wanted to talk about those things, but from an angle of how can we highlight what is going well, what people are doing correctly, and what happens when everything comes together. I think that it's very common that we start off riding on horses that are perhaps, deemed to be quiet and calm and safe, often because they're a little uncomfortable. And so we get used to riding horses that maybe show some of these signs that they're not happy. And we think of those as the happy horses, and it's normalized in our minds. And so some of us never really get an education on what it is we should look for in a horse to confirm that things are going the right direction. So we thought, there's no one better to talk about this than Dr. Dyson, who has looked at thousands and thousands and thousands, if not millions, of horses that have issues, but also horses that don't have issues. And we are both riders ourselves and trainers, and understand the intricacies of what sort of training methods might contribute to those problems. Of course, Dr. Dyson's very familiar with all of the orthopedic problems and other veterinary problems that can interfere with a horse's happiness. So we're going to try and break that down a little bit and see if we can help people understand what they should look for, what to look for in a picture on social media, what to look for in a sale horse, what to look for in their own horse if they're trying to stay on track and make sure that their horses have the best welfare possible. So I'm going to start out asking you what, just with some broad strokes, what's the answer to that question? What should a happy horse look like?
Well, I guess I'm going to start by being a little bit controversial by saying happiness is an emotion that we experience as human beings. And I'm not sure we necessarily can say that we know that horses actually experience happiness, defined in the dictionary as a sense of joy, which implies a kind of transient nature of happiness for us. Whereas I think what we're thinking about in the horse is the comfortable horse, the horse that has well-being, the horse that is in harmony with its rider, rather than saying the horse is truly happy. And we can also say that the presence of pain in humans cannot preclude happiness. So, for example, take a 59-year-old lady who has chronic hip osteoarthritis, and her daughter, age 35, gives birth to a healthy son. And she is transiently, the new grandmother, she's very happy despite the fact that she's got chronic discomfort.
Mm-hmm.
But we don't know if horses undergo the same emotions.
Mm-hmm.
So I think it's very important that although we're talking about the term that everybody uses, the happy horse, we're really talking about the horse that is comfortable. It's pain-free. And those horses should be interested in their environment. They should have an engaged expression. They should interact with other horses. They should interact with their handlers in a positive way. Now, we all know that not all horses get along together, so you're going to have some potentially aggressive interactions between horses. That doesn't necessarily mean they're uncomfortable. That's just interpersonal relationships being demonstrated by horses. Likewise, we have to understand that the behavior that a horse exhibits when we are handling it or riding it is going to also reflect the training that that horse has had historically. So there are many things that we need to be thinking about when we're looking at the behavior of the horse. But the horse that is comfortable, stands, not constantly resting a single limb. It will move about spontaneously. It will come to the stable door when you enter the yard in anticipation of being fed. If the horse is not reacting to the anticipation of feeding, something probably is not right, because almost all horses have been conditioned through neurological pathways to want to eat.
Mm-hmm.
And if they don't react to food being available, then that is generally an indicator that something is not right. Now, they may change their behavior if they're the fourth horse to be fed. So if in anticipation of that, the horse may start windsucking if it's an inherent windsucker. And we know that in the brain results in the release of dopamine, which gives the horse a feel-good feeling because of the way that dopamine reacts. So basically, the comfortable horse is reactive and it's responsive, rather than being stoical and withdrawn. And there's this misconception sometimes that a horse that is being very well behaved rather than the fidgety horse experiences less stress.
Mm-hmm.
And I think stress and well-being are not necessarily interrelated, in that you can have a horse that is inherently pain-free, but you come to do, for example, a veterinary intervention. You're going to scrub the leg ahead of a nerve block. And if that horse stands very still, it actually may be more stressed than the horse that fidgets. But we may misinterpret that. We may say the horse that is being fidgety is being naughty or is misbehaving. But in fact, the horse that's standing very stoically may actually be experiencing more stress and have greater release of cortisol. So that those things kind of muddy the water a little bit about what is actual well-being. So really, when we're looking at the horse to say, is this horse a comfortable horse? We're looking at it initially without any formal interaction from ourselves. We're looking at how the horse reacts spontaneously. And then we have to see how the horse reacts to various things that we do with it, whether it be it picking up its feet or putting the saddle on or whatever.
Yeah, it makes me think of another conversation I've seen happening a lot this week, because in the US at least, I don't know how it is there where you are, but it's been really cold in a lot of places here the last few days. And I've seen a lot of people talking about horses that don't normally come inside. and aren't normally blanketed. And there's been a huge amount of conversation about, oh, this horse, needs to come inside, needs to have a blanket on because it's so cold. And so they're luring the horse inside with food and then throwing the blanket on, and the horse is standing very still, and they're saying, oh, he must have been cold. He's enjoying having this blanket on. And there's a lot of, disagreement with people saying, no, that horse doesn't need a blanket. Horses are fine without blankets. And, how do you tell if a horse is actually, wants to be blanketed to be warmer, or whether they're like freezing because, freezing with fear because they're not used to having something touching them like that. And so, that stoicism, I think, is common in that situation. And it's I think what you're saying about, will they respond to other things that they normally respond to, like lifting a foot or touching a target, or any of the other behaviors that you might be working on, outside of that scenario, that are a good way to evaluate whether that horse is actually comfortable or just putting up with it and not.
Absolutely. And I think that this thing about rugs or blankets and stabling versus non-stabling is again portraying our feelings. We assume that the animal must be uncomfortable because we're cold if we go outside.
Right.
But horses are not human beings. Horses are used to being outside, and they adapt, and they have incredible mechanisms of adaptation. That's why if you feel the temperature of horses' feet, they fluctuate during the day because they have the ability to constrict the blood flow to the feet without compromise to the feet function, but in order to preserve heat internally. And that's a remarkable adaptation of the horse and other species too. So I don't think, and they've got thick hair coats unless we've chosen to remove them,
Right.
which are there to protect them. And in fact, you can put rugs on horses and actually overheat them. And there's been a study done by David Marlin in the UK, which has demonstrated that. And horses react adversely to being overheated by blankets.
Yeah, his research is really fascinating. I highly recommend looking that up. We can post a link to some of that because I think it's really helpful on that topic. But we're getting a little bit off track there. But I do think that is something that people misinterpret behavior very commonly. And with clipped horses, they don't necessarily work on getting a horse used to the blanket before it needs to be on regularly. And I definitely work with a couple of horses that I think don't go as well in the winter because they're spending a lot of time standing around being stressed by having that body contact that they don't enjoy. So we'll move on from that. So other things that you would look for outside of the arena, things in the stable. You talked about how they would behave in the pasture, but what about when you start to bring them in and you get to you approach them and then you bring them in and you start grooming them?
Well, assuming that the horse has been taught to be led and how to respond to the cues to be led, the horse should walk energetically to the stable. If you're approaching it in the stable, the horse should either approach you or stand still. It shouldn't retire away from you. It shouldn't move away from you. When you look at it, the horse should look as though it's got an engaged expression in its eye and it's interested in its surroundings, rather than having this rather glazed expression, not really focusing on anything in particular. And so the position of the ears is also important. If the ears are forward or upright or rotated to the side, that's a sign of engagement. If the horse is just standing there with its head and neck low, so that the head and neck is below the position of the withers, and it's got a glazed expression and its ears are back, that is not the posture nor the expression of a pain-free individual. And then when you start to do things like groom the horse, then a horse which is pain-free should stand without fidgeting constantly. It shouldn't be picking up limbs. It shouldn't be swishing its tail. It shouldn't be opening its mouth or threatening to bite, because all of those are not normal behaviors. And many horses who are normal will particularly enjoy being groomed in some specific areas. Particularly, for example, you take a curry comb and effectively scratch the withers area. That's an area where horses, when they are mutually grooming, get obvious satisfaction from mutually grooming each other. And you will see some horses and they will change their facial expressions. They may snort, they may change the length of their muzzle, showing the fact that they are appreciating what you're doing, and they will almost lean into you to encourage you to do it more. But if the horse just stands there completely unreactive, that's not normal. Now, obviously, the horses are different. There's a spectrum of horses, just like there's a spectrum of people. And some of us are more engaged with other people than others. Some are more inherently withdrawn. So you have to say there's a spectrum of horses. But what I'm talking about is that group which comprises the majority.
Yeah, as you're speaking, the walking energetically and ears forward and engaged, I'm thinking about all of the lesson horses I've ever known, and how many of them sort of drag their feet coming out and just stand kind of dully. And how much do you factor that in if the horse is then brightening up when they're ridden, and if it's just exclusive to the getting ready process? Are there some that don't enjoy that part that then are okay for the rest of the part?
I don't think there are many horses that would fall into that category, actually.
No, you don't think so? Okay.
No.
No. Yeah, I just think about all the lesson horses I've known that are sort of disengaged during the grooming part. They spend a lot of time standing, tacked up, getting bored and that kind of thing. I think what you're talking about, and then you started talking about the fidgeting and all of the different signs of being stressed while grooming, and it seems like there's a line between being expressive and being fidgety, and I'm thinking about horses that I've known that are like you said, on a spectrum. I would call them body sensitive to being touched, whether in a good way or a bad way. And how I would, at what point would I delineate just being sort of sensitive from it being an indicator that they're uncomfortable?
I think that's a matter of you introducing yourself to the horse. And this is what I do with every horse that I meet. I introduce myself to the horse. I start feeling the horse in a systematic way.
Yeah.
And if the horse is hyperreactive, then I slow down and I start again. And if the horse progressively improves, then I think, well, this was just a little bit of a hyperreactive horse. It's now getting used to me and what I'm doing with it, which is a contrast to the horse which continues to be hyperreactive when you are touching it in various places. And at the far extreme of abnormality, we will encounter horses which are experiencing something that we call wind-up, in that they become really, really hypersensitive to palpation on various parts of their body, particularly the caudal neck region and the lumbosacral region. And these horses become extraordinarily hyperreactive and sometimes dangerous in their behavior. But that's going away from happiness. That's the result of chronic discomfort.
Okay, interesting. Yeah, I mean, I'm sure other people listening are probably, experiencing that in the same way I am, which is going back and thinking about horses we've known that, were reactive in the cross ties or being tacked up. And I mean, I've had horses that I have to go very, very slow with, and I think I tend to default to that with any new horse because I've had those experiences of horses that were so reactive. But were okay if I approached them slowly, started, usually starting at the head and moving backwards as opposed to just touching the back cold. And, just thinking about if I knew then what I know now, would I have investigated further to see if there was pain? And, of course, I always think about now knowing the 24 behaviors and counting them in my head, I can think of all the horses that I've ridden that I would have for sure wanted to investigate. But let's keep going. So we've talked about body handling and grooming. What about when you start to tack up? I know you've done a whole bunch of research on behavior while being tacked up. Can you talk about that?
Yeah, we looked at 193 horses during tacking up and mounting. And these were all horses that were in regular work and assumed by their riders to be working comfortably. And so we observed them during tacking up and mounting, and we had a predetermined checklist of a huge number of behaviors during both tacking up, putting the bridle on, putting the saddle on, and doing the girth up, and then going to the mounting block and being mounted, or the rider being given their leg up, or very occasionally a rider choosing to get on from the ground. And then we also assessed these horses' reaction to palpation of the back. We assessed their saddle fit, and we assessed the presence or absence of lameness in hand, or lameness or abnormalities of canter when ridden. And these were all done by independent people. And we showed that the horses that had well-fitting saddles and were comfortable during ridden exercise and didn't show any signs of lameness showed very few signs when being tacked up. So they would stand still. They would have an engaged expression. Their ears would remain either upright or forwards or to the side, not laid tightly back. They wouldn't open their mouths and constantly chomp on the bit. They wouldn't react when the saddle was placed on them. Their legs would stay on the ground. They didn't swish their tails when the girth was applied and tightened. They wouldn't turn their head towards the girth. So they would just stand still and stand there without being restrained in any way. Or if they were in cross ties or tied up, because the owners were asked to do the tacking up as they normally would. So they were there looking comfortable, unreactive, but not in a pathological sense. They were unreactive in that they weren't showing abnormal behaviors. Mm-hmm. Whereas the horses which either had ill-fitting saddles or were lame or had problems with canter were much, much more likely to show many abnormal behaviors, like attempting to bite the handler or opening the mouth repeatedly, or rapidly blinking, or laying their ears back, picking up a front leg, kicking with a hind leg, swishing their tails. The behaviors were very different during tacking up. And then when it came to mounting, the comfortable horse walked to the mounting block and stood still whilst the rider got on, and normally waited for the rider's cue in order to move forwards, although some horses were clearly less well trained than others, and as soon as the rider was in the saddle would walk forward, but they wouldn't show any other abnormal sign. There were a couple of horses that exploded in bronching as soon as the rider was in the saddle. Those were horses with both ill-fitting saddles and abnormalities of gait when they were ridden, so indicating that there was a likely causal association between those abnormal behaviors and the discomfort that the horses showed when they were ridden. So it's not rocket science. It's obvious when you think about it, but having grown up working in a riding school as a small child, I was exposed to many of these abnormal behaviors, and we were told this is just normal for these horses. But I believe it was because those horses were experiencing chronic low-grade discomfort. And therefore we learned that these were, or we assumed that these were normal behaviors for horses. And they are normal behaviors for uncomfortable horses.
Right.
And what we need to appreciate is that the comfortable horse does not react like that.
So I have a few questions about that. So I know, so one of the things that we always try to emphasize is that with the 24 behaviors, it's a number of 8 or more that indicate lameness or are likely to indicate that there's lameness going on. In the behaviors you're talking about, it's not, that's not the delineation, correct? At one behavior.
No. But I think that the take-home message is the more abnormal behaviors the horse shows, the more likely it is to reflect an underlying problem, either with the fit of the saddle, or and that includes the fit of the saddle for the rider, because that will influence how the rider can or cannot ride in balance, and the underlying presence of musculoskeletal pain or pain induced by a rider that is too big for the horse and crooked, and therefore you've got asymmetrical forces being applied through the horse's back, which the horse is going to react to.
Yeah, I worked with someone yesterday who bought a horse 3 months ago, and the horse was extremely fidgety at the mounting block and was also having some behavior under saddle. And so she's been spending the last 3 months really going back to the basics and just working on teaching him to stand at the mounting block, but also getting the saddle fitted correctly, having body work done, all of these other things. And, you know, now after 3 months, he stands beautifully at the mounting block and is perfectly relaxed and calm. But it would have been very easy for her to just say, that's just mounting block behavior, jump on and get right to the riding stuff, and not connect it to the stuff that was happening under saddle, which was spooking.
But I think it is always important, if you've got a problem with mounting, say, well, can I retrain the horse?
Mm-hmm.
So if the horse is moving away, can I teach it that it's the right thing to stand still? And if it's moving away, use a little long whip to just tap its hindquarters to encourage it to move the hindquarters back towards the mounting block, and then reward it for what it's done positively. So you may have a normal horse which has learnt this behavior because it's never been properly trained, and you can retrain it and then it stands fine. You could also have the horse that historically had some pain. It has become habitual that it does this behavior when mounted and needs retraining. But if it cannot be retrained, or you've got a transient improvement and then the behavior recurs, then that to me indicates that the likelihood is there is an underlying discomfort somewhere.
Yeah, I would emphasize that it can be both, because I think with this horse I was working with, it was both and is both. And also that when you're training it, it's important to train it positively, like you said, because if you punish the horse for moving off, it may learn to stand still, but that's not going to create a relaxed behavior that is the kind of thing that we're talking about, that you want to see, where they're willing and happy to stand there, or not, we won't use the word happy, but if they're comfortable standing at the mounting block. You don't want to add tension to that situation. You might get shut down behavior, but you're not going to get relaxed behavior. I know we've talked about this before, and I think it's something that people are always curious about. If you do nerve blocks on pain that might be causing these behaviors, will these behaviors in the tacking up and mounting process go away in the same way that lameness will go away? No.
It takes time. So my experience is that we have to treat the underlying problem and then the behaviors will go away. But that may take several weeks. So it's very different to the behaviors of the ridden horse. So when we take away the pain in the ridden horse, their behaviors almost exclusively improve immediately, whereas we don't see the same improvement for tacking up and mounting behavior. It takes several weeks with the continued abolition of the discomfort, the underlying problem.
I think that's a very important point for people to understand. So let's move on to the ridden horse. Let's talk about, can you talk about walk, trot, and canter? What are things that that you would look for to indicate a horse is comfortable just in general?
Well, the horse should respond appropriately to the rider's cues. And I'm assuming that the rider is using the cues appropriately. So that if I put the leg on and then release and the horse moves forward, that's the response I expect to get. That the horse immediately responds by moving forwards in a regular rhythm, and with a step length and animation in walk, trot, and canter that you would expect for that type of horse. And it's going to look very different in a pony versus a warm blood bred for dressage, for example, because they have completely different gaits. But they need to be responsive. They need to be willing. They're going to go forwards by and large straight, recognizing that horses have some inherent crookedness. They should take an even contact with their head held in a vertical position rather than the nose being tipped to one side or the other side. They should remain in a regular rhythm and look expressive, like this horse. This was a horse that I was riding for somebody. You can see that its ears are forward. Yes, it's paying attention to my cues, but it does so with its ears forward. We can see that it's got an engaged expression in its eye. Its mouth is shut. Even if we took off the flash, the noseband, the flash noseband, then the horse's mouth would remain shut. We can see that this horse is moving forwards with some degree of animation and expressiveness. And this was maintained during transitions. The horse did not change when you went into sitting trot versus rising trot in terms of both its outline and its rhythm. And that's a normal response. The horse should be able to canter easily with the correct forelimb leading and maintain that canter around the short sides of the arena. So all of these are horses that are looking, let's say, happy in what they're doing. They're doing what they're doing willingly. They're very responsive to the rider's cues, and they do so in a repeated fashion. And this doesn't change very much. Obviously, we're showing individual photographs, but I can say that if you were to look at multiple photographs of these horses, they were all pretty much the same. Now, if the horse was out hacking and a bird suddenly flew out of the hedge, the horse may spook. That's normal. That's not an abnormal reaction. That's the horse reacting to its environment. If this horse is going through water here, the horse has a more expressive movement of its limbs. This, in fact, is a chestnut mare, and contrary to the typical way that people regard chestnut mares, this mare is a compliant mare. I've ridden this mare too. She's an easy, compliant individual who enjoys her work, be it working on the flat, hacking out, going over small cross-country fences, or going through water like this. And these are all photographs of what I would expect to see. And I think when you look at all of these horses and you look at the way they're moving their hind limbs and the way that there's not a kind of hollow behind the saddle because they're moving through their backs, they're moving their backs properly. And this is in contrast to many horses which have low-grade discomfort in that they, first of all, react by stiffening their backs. And instead of seeing this carriage of the tail, and you can see that this tail is being moving slightly to the left now, but as the horse trots, the tail oscillates from side to side, reflecting the movement of the horse's back, which you as a rider should be able to feel, this lovely movement through the horse's back, which doesn't throw you unduly out of the saddle. And it's also important that the horse, a normal horse, assuming it has got a rider who is in balance and assuming its tack fits properly, both the horse and the rider, when we do an upward or a downward transition, the horse should maintain basically the same outline and should be comfortable in doing that. Now, you will see this horse has separated its lips, but it hasn't separated its teeth. You're going to have horses that are going to show that transiently. That's not a problem. Everything else about this horse, who is a young horse being worked long and low, this is a retrained racehorse undergoing rehabilitation, having been a former racehorse. And we are seeing again that this horse has got a nice round outline. It's swinging through its back. It's stepping forward well. And importantly, it's not dragging its hind toes. If the arena surface is deep, then a normal horse may drag its hind toes. But if there's a nice surface like this, we shouldn't see constant kicking up of the arena surface. Constant toe dragging is not normal. So I think these are all the features of what we should look for in a pain-free individual.
I'm going to say to Megan, stay on this picture for a minute because I have a question. Did you finish your thought?
I'm going to go and talk about how to feel, what the normal horse should feel like.
I think so I'd like to ask before we get to that, because this picture made me think about how many times just in the last week, but overall, I've seen discussions about long and low or deep round and low versus behind the vertical versus hyperflexion. And I feel like I've seen people identifying certain things as hyperflexion that are not hyperflexion. Can you just real quick sort of run through what to look for in the silhouette that indicates comfort through the head and neck?
Yeah. This horse, I would like in the ideal world to see its nose a little bit more in front of the vertical. This rider is not the most skilled rider. I've watched her ride quite a lot of horses. And she's also not hugely well in balance. She tends to have her lower leg too far forward. But despite that, she does know what she's attempting to achieve. She just hasn't quite got the horse's head a little bit more in front of the vertical that we would like to see. But the basic outline of the neck is not at all bad for a horse that we're trying to encourage to move through its back and engage its hind limbs. So this is not hyperflexion by any stretch of the imagination. Hyperflexion, otherwise called roll-cur, is with the nose way behind the vertical, more towards the chest, sometimes also accompanied by extreme flexion to the left or to the right, in addition to the horse being overly flexed. Now, we talk about in dressage that ultimately we want the pole to be the highest point of the horse's neck. but that's not necessarily what we're going to be doing when we're training a young horse or a horse that's done a previous job, which is completely different. This was a flat race horse. We're training it to be a riding horse now. So we want it to learn to stretch its neck and head forwards and downwards, which is completely different to how this horse has moved historically. So I think that the head and neck posture is going to depend very much at what stage of training the horse is at. But we also need to remember that every horse during a period of work needs to be able to be flexible in its position. What you as a rider should be trying to achieve is that you can say, now I want the horse to stretch forwards and down. Now I want the horse to bring its head up a little bit, which should be something that you as a rider can achieve with appropriate training. The degree to which you can change that is going to be influenced by the musculoskeletal strength and coordination of any individual horse.
Yeah, that's such an important point, because I think we have successfully trained an entire generation of horse people to recognize when a horse is behind the vertical. And it's one of the things that's easier, I think, to identify in a still picture for the average person. And so it seems to be the first thing. And, there's been a major campaign against it, not necessarily, successfully, because we still see it all the time. But people have learned to spot that. But I do see people riding young horses that are purposely not riding them through because they're so afraid of any moment behind that vertical line. And so I think it's a really important distinction to make, that it is not necessarily that there's a middle ground there. There's not necessarily black and white differentiation between in front of the vertical and behind the vertical.
Absolutely. Yes.
Yeah.
Yeah.
Okay. So you talked about the difference in articulation in the water and hard versus soft surface. I want to make sure that people understand what you're saying about the toe drag. Now, a toe drag in deeper footing would not be as concerning, correct? As
yes, because in deep footing, you will observe that many horses cannot properly bring their hind feet out of the surface. They will kick up the surface. And so when you're looking at the movement of the hind feet and the surface, you have to appreciate the nature of the surface. But if you've got a fairly firm waxed sand, for example, the horse should not be constantly toe dragging.
What about on an incline, uphill, downhill?
The horse should remain being straight and remain willing. If the horse starts to go sideways coming downhill or be reluctant to go downhill, that's not normal. Now, a young horse may find it a little bit more difficult. They may feel a little bit more wobbly underneath you and less well coordinated, but they will still generally go straight. They may take slightly irregular length steps because they're not quite sure what they're doing. But over time, over several weeks, that should progressively improve. Whereas if there's underlying pain, that doesn't go away. Those irregular steps or slight crookedness or unwillingness to go downhill may remain the same or actually get worse. When you're going uphill, you should feel that the horse is pushing symmetrically with both hind limbs and being powerful. If it feels weak going uphill, then you have to ask, well, why is it weak? Is it because it is inherently a weak horse? Bearing in mind that you take a 4-year-old, you take 2 4-year-olds, you may get one very muscular looking, mature looking 4-year-old versus a horse which is clearly much less well muscled and more gangly. You don't expect those two horses to move the same, with the same degree of push and the same degree of coordination, but the behaviors are not going to change. It's just the power that's different between the two horses. And the gangly, less well-muscled horse needs more time to develop, needs to be taken more slowly than the more mature horse. But both of those horses are showing normal behaviors. They've got their ears pricked, they're looking engaged, they're responsive to the cues, but it's just done in a much more powerful way in the more mature 4-year-old versus the gangly, weak 4-year-old. But if that gangly, weak 4-year-old doesn't develop over the next 9 to 12 months, as you would expect with appropriate training, you have to ask why. Because if it's still gangly and weak a year later, that reflects probably that something's not right.
Yeah, and that raises a really good point because, we refer to correct training, appropriate training all the time, and those are terms that aren't necessarily clearly defined. It's one of those things, you know it when you see it. But I think one of the ways that I do define it is my training staying under that threshold of seeing these kinds of behaviors? If I see them and I change my training, do they go away? And then am I increasing the ability to do more over time without those behaviors resurfacing? So these really are, when we talk about what is appropriate training, we're really talking about paying attention to these signs, right?
Absolutely, absolutely. I mean, we can have a general target, but we have to remember that each horse is an individual with respect to its inherent athleticism and its mental ability to process and learn. There are some people who are very intelligent and quick learners, and there are others that are slower. And I think we see the same in the horse.
Yeah, I'll give a little plug right here for the 24 behaviors in our field guide, because I think this is you always advocate for people to track these things on a consistent basis. Don't wait for there to be a problem to use the tools to evaluate your horse, but be tracking them on a consistent basis, monthly or weekly or whatever it is that is doable, so that you have data to compare. I think the value of that, it can't be overstated. It's our brains fool us into thinking we have always seen what's in front of us, but having those hard facts in front of us are a great way to tell whether we're on the right track with our training. We didn't talk about jumping yet, right? Yeah.
No, we haven't talked about jumping. I think that some horses are more athletic than others. Some are more confident to jump from a very early age compared with others. So some need more training than others. But with appropriate training, I personally believe, through my own experiences, that most horses should be able to jump competently up to a meter, just as most horses should be able to perform most dressage movements up to what we would call medium level. So basic half pass, shoulder in, simple flying changes. So they don't need extraordinary athleticism to be able to do all of those things, provided that they are appropriately trained and they have the confidence, which is reflection of their training. And yes, there are going to be some horses who are very inherently spooky about walking over a pole on the ground initially, but you should be able to train them either just by working them from the ground or through riding them, or a combination of both, or by giving the horse a lead from another horse so that they gain that confidence. So there are many different tricks that we can use to help the horse develop its confidence. But again, most horses, in my experience, like doing some form of jumping, at least at a low level, assuming that they're pain-free, and so should do it with their ears forward, as we saw from the jumping pictures, and should approach in a regular rhythm. They might not hit the right takeoff spot every time, but they're still going to try to jump. The shape they make over a fence is going to reflect their athletic ability, and some are going to have a more inherent bascule, that's arching of the back over the fence. Some are going to bring up their front legs much more than others. Others are going to really extend their back ends over the fence. But taking away from that, every horse should be able to get to the other side reasonably and land looking comfortably and move off comfortably in the same sort of canter stride that they approached, or the same trot stride on which they approach, depending on the selected pace, and do so similarly off the left and right reins.
Yeah, it's interesting. There's a few horses that I can think of who I would say don't look particularly sound on the flat, but will brighten up and get sound when they start to go over poles or jumping. And I think there's a lot to be said. We haven't really touched on the topic of enrichment, which is a topic really close to my heart and Megan's heart. We teach a lot of workshops on doing enrichment with horses, but horses need novelty. They need opportunity to express natural behavior, which, jumping, I think, is a natural behavior for most horses. And a lot of them really do get more interested in the work. And
yes, I would agree with that. But I would think there's a big caveat here, because I hear repeatedly, my horse does not like dressage.
Oh, yeah.
He loves jumping, so he must be okay.
Yeah.
Which is an absolute myth.
Absolutely.
Because most horses that the rider interprets doesn't enjoy dressage is experiencing some degree of discomfort during the flat work. But when it comes to jumping, it's not put under the same musculoskeletal stress.
Yes.
And it begins to release adrenaline and endorphins, which are feel-good factors for the horse, just as they are for us.
Exactly.
And therefore they can override any underlying discomfort. Yes. So the fact that the horse is willing and seems to enjoy jumping does not preclude the fact that there may be an underlying problem.
Yes.
But I strongly believe that all horses need some degree of cross-training in order to enrich their lives. To be doing too much of the same thing is boring and is not good for the musculoskeletal system either, because you're using the same body parts over and over again, which is going to predispose to the repetitive strain type injury that many horses are inherently predisposed to. So I think that cross-training is really important. Yeah, but I also think we need to move on to how you as the rider should feel when you're riding a horse.
Yes.
Because I think that those of us who've had the opportunity to ride pain-free horses and think about what they feel, know that there are big differences between a pain-free horse versus a horse which is coping with underlying discomfort. So for me, the pain-free horse is going to be responsive to my cues. It's going to take an even rein tension so that I have a similar feel in my left and right hands. Now, the horse may transiently take a stronger contact in the left rein, but by asking the horse to take a more contact in the opposite rein, then I should be able to re-establish an even rein contact. The horse I should feel that I've got some connection with the horse's mouth, that if I close my fingers on the rein, then I should feel that the horse is mouth responds in some way, rather than feeling that I've got this kind of dead feeling in the horse's mouth when the horse just leans on the bit or doesn't in any way respond. That's not normal. When I'm sitting on the horse in the walk, I should feel the back swinging from side to side. There's more movement of the back from side to side in walk than in either trot or canter. So I want to sit on the horse in walk and ask myself, is the horse moving through its back? Do I feel the horse's back swaying behind me, the area behind the saddle in particular? Then when I go into rising trot, I want to ask myself, does the horse continually throw me up on one particular diagonal? So if I'm going out on a trail ride, does the horse, every time I go into trot, always throw me such that I'm sitting when the left front and right hind diagonal are bearing weight? Or does the horse apparently not mind which diagonal I sit on? And if I change diagonal, does the horse feel any different on the left versus the right diagonal? A horse which is pain-free should not feel majorly different between the left and the right diagonal. Whereas the horse that has got, in particular, hind limb problems will often be more uncomfortable when you sit on the diagonal of the lamer hind limb. And those horses will often preferentially throw you onto the opposite limb diagonal when you go into rising trot. Then in the canter, you should feel that your pelvis is being rocked backwards and forwards, and there shouldn't be a jarring sensation going up through your spine. If you feel that your body is being rotated, and there's this jarring sensation going through your spine, that is not normal. You should feel when you are performing a downwards transition, either from trot to walk or from canter to trot, that the horse wants to step under from behind, and you don't feel that it's falling downwards into a more strong contact in your hand, but it is stepping under spontaneously from behind and taking even steps. If we go back into trot, and I go from rising trot into sitting trot, I should feel that the horse maintains the same rhythm. It should still move fluently through its back. So again, you don't get a jarring sensation through your back. And the position of the head and neck should stay the same. If you feel that the horse braces its back and begins to raise its head and neck, that is not normal. Now, it may be a reflection of you. And when we're talking about the comfort of the horse being ridden, we also always have to think about the horse tack rider triad, because it may be that the horse, if it's not normal, or is not feeling as I've just described, it may be because the horse has a problem, but it may be that the saddle is uncomfortable for the horse, or it may be that the rider is inducing discomfort for the horse through the way in which they're sitting. And one of the important things, I think, is always to recognize that although horses vary a bit from day to day, just like we do in our general demeanor, if we see a marked change, then from one day to the next, we should say, well, that's not normal for this horse. I was on a riding safari in Kenya last week, and I rode a horse for a day and a half, and the horse wasn't perfectly sound behind, but it was okay, absolutely fine to do its job. And then the second afternoon, this horse just really didn't want to go forward, which was uncharacteristic for it. It had been walking out at the front, always wanting to be at the front. When it saw a giraffe, always interested in the giraffe. That second afternoon, didn't want to go, would be at the back of the pack. disinterested in the draft. That signifies that something's wrong. That horse had low-grade colic that afternoon, in my opinion. So it's really important that we recognize what is normal for our horse. And if that changes, then say, well, why has it changed? What is the inciting cause for that change? But it's also important to recognize that some changes in behavior may be slow and insidious in onset. And you, because you may be only riding that one horse, maybe every day or maybe only every other day or whatever. And that's when it becomes really important that you pay close attention to the horse's behavior, because the change in behavior may be the first indicator that something is not right. And don't blame yourself. I've intimated the rider can be the problem, and we can never underestimate in some horse rider combinations how hugely influential a rider can be on a horse's performance. But at the same time, I see time and time again riders blaming themselves for too much. They immediately say, well, I'm right-handed, that's why I got a stronger contact or increased rein tension in my right hand, because it's me. But that's not necessarily the case. It's really important that riders don't take on too much responsibility and blame themselves.
Yeah, we've talked about this before, but I think there's a couple different reasons that people default to that. One is that, we have conditioned a generation of riders to give their horse the benefit of the doubt and look to their own behavior and their own riding as the cause of problems, which is a good thing in a lot of circumstances. But I do see it a lot of times, and I see trainers in particular want to focus on the rider being the cause of issues. And I think it's a complicated problem, but I think one of the reasons is that the riders are easier for us to fix as trainers. I know how to teach a rider to be different. I'm not a vet, so if it is a musculoskeletal problem, I reach the limit of my professional ability to help, and also I lose income at that stage. And so I think a lot of trainers have, whether they realize it or not, they have some motivation to blame the rider, as opposed to look to it being a lameness issue. And that's a complicated set of issues, but I think it's, so as a behavior consultant, I always look to physical causes as the first thing I want to rule out. I think that's a good rule of thumb, is to look to that first and get it, peel away the possible causes before you jump to things that are more you're able to control as a rider.
But I think it's also important to think about the horse that is learning new movements. And they may struggle initially, and they may show some abnormal behaviors, like they may swish their tail, they may take irregular steps, they may open their mouths, which we think are abnormal behaviors. But with appropriate progressive training, the movement should become easier and those abnormal behaviors should disappear. And I think it's really important that we recognize that when we're introducing a new movement, the horse may struggle somewhat, but it should progressively improve as long as there is not an underlying problem. Now, whenever we're introducing a new movement, it's usually because we are increasing the difficulty of what we're asking the horse to do. And it may be the horse previously was coping with any underlying discomfort. And now when we ask more physically demanding things of the horse, it then begins to become uncomfortable. And if that's the case, then the horse will not progressively improve with the appropriate training. And that's how I think we differentiate between a training related problem versus the discomfort related problem.
So to bring this kind of full circle around to some of the conversation that has been going on social media about a photo being a moment in time, when horses are competing at the very top level of their sport, specifically I'm thinking about dressage, I think is the most common example of when we see horses exhibiting a lot of these behaviors, even though they're at the top level of their training. Is it normal for horses who are doing doing the Grand Prix is a difficult athletic endeavor that to me seems like it would cause stress under the best of circumstances. So are some of these behaviors, quote unquote, normal under that kind of stress?
I think that's a very interesting question to debate, and maybe it's almost a whole session in itself. Yeah. But unquestionably, we have data to show that Grand Prix dressage horses are much more likely to have their mouths open on a repetitive basis and to swish their tails, which may or may not be in association with the application of a spur cue. Now, is that mouth opening a reflection of the way the rider is using their hands on the double bridle? But there is a study using 7 dressage riders being observed riding a horse in sitting trot on a treadmill, and they observed even in these horses working on the treadmill that they would repeatedly open their mouths, and it was seen that this was in synchrony with slight upwards and backwards movement of the rider's hands. So how much is this related to the rider's cues? How much is it related to the fact that Grand Prix horses are worked in double bridles, whereas at lower levels of dressage and in eventing, there is no compulsion to use a double bridle, and most of the horses are ridden in snaffle bridles? Or is it a reflection of the difficulty of the movements? But when you see a horse such as Delira at the World Cup last week winning, and with every single movement having its mouth open, I begin to think, well, that cannot relate to the difficulty of each individual movement, because some of it, collected trot, is not difficult for a Grand Prix horse, but it's still opening its mouth all the time. So what is the reason? Is it the double bridle? Is it the movement of the rider's hands? Does the horse indeed have some underlying musculoskeletal discomfort? Should we be rewarding a horse with a score more than 90% if it's doing that? All very controversial points.
Yes, yeah, exactly. Which we're not getting into today, but I think it's very interesting to talk about. This is all on a spectrum, and there isn't a simple answer to that question. We do have a couple of questions, which I'll ask you real quick before we wrap up. One just came in. Do you do any evaluation by video to distinguish pain versus training difficulties?
I think with good quality video recordings, you can make an assessment, but the quality of the videos has to be good. That is, you need to have footage of the horse moving from behind, from the side, and from in front. And the video footage should be zoomed in so that you're looking at the whole horse in the whole screen most of the time, rather than the horse disappearing as a blob at the far end of the arena, because then you can't make a judgment at all, in my opinion. But I think with good quality video footage, I think you can make a fairly good judgment as to whether or not it's a training issue versus a underlying pain related problem. Yes.
And then how to deal with a low grade chronic lameness in a horse who exhibits less than 8 pain behaviors and is performing adequately. And this part 2 of this is why are Butte trials often not seen to be useful?
Well, let's take part 2 first, because that's the more straightforward one, really. Phenylbutazone or Bute is a non-steroidal anti-inflammatory agent which provides some pain relief. It needs to be given at a dose rate appropriate to the horse's body weight, and it needs to be given for long enough at that body rate, but at that appropriate dosage rate. So if I'm doing a test, I would use a dose rate of 4.4 milligrams per kilogram twice daily. So for a 500 kilogram horse, that's the 1,000-pound horse, we would be talking about 2 sachets twice a day. And I would be maintaining that dose for at least 7 to 10 days. Many people who put their horses on a Bute trial do it at a dose which is too low for the horse, and they don't maintain the dose rate at the same level. They taper it off, and they don't continue treatment for long enough. If I'm advising we do a Bute trial, I will always say, document on a daily basis the horse's performance for the week preceding the trial. Continue the horse in the same sort of work pattern during the trial. Again, document the horse's work characteristics. And then when you stop the phenylbutazone, again for the next week, document the horse's performance. And in that way, you are more objective in saying, was there really an improvement during the trial, or did the horse deteriorate after stopping treatment? Because if the horse started deteriorating after stopping the treatment, even if you didn't appreciate marked improvement during the treatment, that deterioration reflects that the phenylbutazone was having an effect. But phenylbutazone does not influence all pain, and it influences pain in a rather unpredictable fashion. So you could have 2 horses with navicular bone pain, and one may respond to phenylbutazone, the other does not. So there's an individual variability as well. So I would always say that a positive response, that is improvement in the horse's ridden behavior with phenylbutazone, means there must be underlying pain. But a negative response doesn't preclude the presence of pain. So you could have a totally negative response. It doesn't mean the horse does not have pain. So coming back to this horse, which is performing adequately and shows less than 8 behaviors, well, we've always said that there are some horses that have low-grade musculoskeletal pain that don't show 8 or more behaviors. It doesn't mean they don't have musculoskeletal pain. And the fundamental issue for me is, well, you say it's performing adequately. Has its performance deteriorated, or could its performance be better? And if you've got a concern, then it merits further investigation. And the general principle in investigation of any pain-related problem is the use of nerve blocks, that is diagnostic anesthesia, to identify the source or sources of pain so that you can then image that area to determine the cause of pain. Without knowing where the pain is coming from, you cannot treat in a targeted fashion. You're just playing guesswork by injecting the coffin joints or injecting the hop joints. And to me, it's better to define the underlying source of pain.
Mm-hmm. So for people that have listened to all of this and are now recognizing that maybe there's some signs that their horse doesn't fall into this category of a happy horse, what in a nutshell, how would you suggest they proceed?
Well, I think I would suggest that you acquire some good quality video footage of the horse, look at it closely, and if that substantiates your feelings, then you need to seek advice. Now, where to go first is always a bit of a moot point, because it may be your saddle that doesn't fit the horse appropriately, or it may be because the horse has got an underlying problem. So whether you go to the saddle fitter first, or whether you go to the physiotherapist or other manual therapist first, or whether or not you go to the veterinarian, depends really on your gut feeling and what relationship you have with each of those professionals.
Sorry, we had a couple of questions come in, and whether we'll have time for them now or not, but I thought we might. So one was from a saddle fitter and expressing that they had watched your started using your ethograms a few years ago, and it's really helped their work and trained their eye. And they were asking, why do you think there's so little research into compression over the serratus ventralis area where they tend to find a great deal of restriction in their clients' horses? And also why so much emphasis on methods of testing pressure, etc., rather than focusing on facial expressions and the behaviors. So I didn't know if you wanted to talk about that a little bit.
Um, I think that the focus has been on pressures because that's what people have found it easy to do. And the scientists love to have measurable things. And I have to say that some of the scientists laughed at me when I started to talk about behavior because they said, well, that's a subjective opinion, whatever. And they don't like subjective opinions. They like numbers, and numbers come from pressure measurements. And that's why the scientists have focused on pressure and pressure distribution. And I think there's a certain amount that one can learn from that without a doubt, but it doesn't tell us the whole story because pressure mats only give you accurate figures when the force is applied perpendicular to the surface. And obviously there are many surfaces of the saddle and the horse's back which are not interacting in a perpendicular fashion. So it can be a little bit misleading in some respects. I think it's pretty difficult to evaluate the function of serratus ventralis. I mean, obviously it's an important muscle, but I think that some EMG, electromyography work, has been done in the non-ridden horse, but I think it becomes much more technically challenging to do anything in a ridden horse. But it may be that with the way that science progresses, that may become possible in the future.
Great.
But I have to say that saddle fits, I cannot emphasize enough the importance of the role of saddle fit. I'll just use an example. Another horse I rode last week, horse number 1, I was sure was uncomfortable on day 1. The tree points were incredibly tight. We changed the saddle to a better fitting saddle, and then the horse was obviously very, very much more comfortable, but instantly lame right front. And the fact that it had been bracing its head and neck and back because of the ill-fitting saddle had been concealing the right forelimb lameness.
Very interesting. The other question that came in, and you've talked about this in other of our live discussions and a bit here. So maybe again, in a nutshell, what is the value of observing a horse for evaluating pain on different surfaces, hills, and curved lines?
To me, it's really important because a horse may appear completely non-lame in a straight line, whereas it may appear uncomfortable on a circle. Maybe only on one rein, but possibly on both reins. I think seeing a horse on a firm surface versus a soft surface can reveal different sources of pain. So, for example, a horse with foot-related pain is more likely to appear uncomfortable on a firm surface versus a soft surface. And I'm using the term firm surface very carefully because I don't like really, really hard surfaces. So I don't like concrete or tarmac because I think that is putting the horse in a non-physiological situation. We don't normally ride horses in circles on concrete. So if the horse appears slightly uncomfortable trotting in a circle on concrete, I would be hesitant to place too much emphasis on that if the horse appears comfortable, for example, trotting on a grass surface in a same diameter circle. So I would use the term, I think, firm surface, not a hard surface. And up and down gradients, I think, can be very revealing, because there are some horses which, particularly those with fall in pain, will be more uncomfortable going downhill than uphill, whereas horses with hind limb discomfort may lack push going uphill. So to put all the information together is always the best.
Great. What a great discussion. So before we head out, I'm just going to put some stuff up on the screen as we're announcing. Sometimes it's easier for folks to write things down based on seeing stuff on the screen. So bear with me for just a moment here. So our next live will be on Thursday, February 15th, and we'll be having Dr. Dyson talk with us about one of the 24 behaviors. So we'll sort of zero in on this behavior of tossing and shaking of the head. So mark that on your calendars if you're able to join us, or check back with us if you can't be live, that we'll have new updated content regarding that. Also, thank you to everyone who's been sharing our information. We've been definitely noticing it, and we're very grateful for that, not only for ourselves, but for our equine partners and our horse friends who are benefiting from so many people getting more access to this knowledge. So you can learn more at 24horsebehaviors.org, at the trainwithtrustproject.org. We have a variety of resources available. Also, Dr. Dyson, in partnership, co-authoring with Sue Palmer, have their book out and available through harmonioushorsemanship.co.uk or on Amazon. The Harmonious Horsemanship book, I know, Jody, you've been giving it ringing endorsements and have shared it with some other folks. So it's been really helpful. I don't know if you want to talk about that for just a brief moment.
I'll just add that also Sue Palmer has some great content on her Facebook, which is the Horse Physio on Facebook. She's been posting some of our illustrations that we that we put in our field guide, but she's been adding her explanations and commentary to them, and it's really super valuable. And the book is just really easily digestible. I already knew a lot of stuff about the 24 behaviors, but it goes into depth about all of them with different points of view from different experts, and it's just a really easy read, and I've found it super valuable in terms of using the ethogram as a tool for welfare evaluation. It's really changed the way that I look at all of the horses I work with.
Great. And then again, we do have free resources available, 24horsebehaviors.org. We have our mobile field guide. Dr. Dyson has put together a number of checklists that people are finding very helpful. The ridden horse checklist is the ridden horse pain ethogram of the 24 behaviors, but there's also the additional behaviors checklist. A lot of these were discussed today of normal, abnormal, regarding tacking up, mounting, these kinds of things. We've had people ask us about how to select a vet or a professional who might be able to help with their particular issue. And Dr. Dyson had some guidance about that if you're in the process of looking for a veterinarian. And then also things that you can do to help your vet do a better job of their job is by providing them with a thorough history. And there's a lot of questions that Dr. Dyson will pose for you in that. So there's some great resources there. Those are free. 24horsebehaviors.org. You can, of course, go to trainwithtrustproject.org and also purchase a poster of the 24 behaviors if you want to help spread the word at your barn, at your veterinary clinic. That's also an option as well. So
I will add to that, because we are really bad at remembering to say this, but the Train with Trust Project, we are a 501c3 nonprofit. We make all of this available for free by accepting donations. So if you've enjoyed our content, if you download the content and use it, and you would like to make a donation, you can do that on our website as well.
Yes. Yep. Good job there. We always try to focus on animals first and forget about the coffers that occasionally need to be filled.
Yes.
And thank you for everybody that has been donating as well.
Mm-hmm.
So with that, until February 15th, we'll see you all next time. And thanks for joining us.
Thank you. Thanks, Dr. Dyson.
Thanks,
Thank
Dr.
you.
Dyson.